If you have trouble lifting your arm, you have some pain in here, I want to help you. And I want to encourage you, don't get the cortisone injection. Really, the cortisone has been shown by the Mayo Clinic even to cause thinning of the cartilage, tendon rupture, osteoporosis. It's thinning of the skin even. It even causes changes in blood sugar.
What had happened was I'd had a painful arm. So I went into the doctor and I said, do you think you can help me? They said, let's see what's going on. It came back that I had calcific tendinitis. And they gave me an MRI just to see what was going on.
I'm Adam Fields. I'm a chiropractor, and I use the Piezowave, using low energy, focused shock waves right into the area of your shoulder that needs it to help break up those calcifications. 80% of the time, a calcific tendinitis is this tendon right here, the supraspinatus tendon. They call it the supraspinatus because it's above the spine of the scapula. It goes under this roof right here called the acromion, and there it is right there. That's where the calcification occurs, and then you lift the arm and that calcification pushes up against the roof of the shoulder, and boom, it's a problem. So what these shock waves do is they go in, and these are actually what's called low energy. They used to use high energy shock waves, but the problem is they can damage blood vessels. And you've got the axillary nerve, you've got the axillary artery here, the veins, and so we want the low energy focused. It doesn't take anesthesia. You can do it right in the office and handle it no problem. So we got the focus shock wave, which is going to go right in there and literally break up the scar tissue, break up the adhesions, break up that calcification, and the studies show neovascularization, new blood supply in the area, and then cartilage regrowth and a resolution of the chronic inflammation. It's incredible.
What I needed was some help because it wasn't going away on its own. Sometimes things do, that did not. And I came across the name of Adam Fields, Family Chiropractic. He's giving me the treatment and it's getting a little bit more painful. And at first it was a tingling. I was like, this is sort of tingling. And then he goes, well, let's see if we can do some more. More healing, a little bit better, more movement. And I'm thinking, okay. And he goes, it might hurt a little bit. And it really was kind of painful, but in a strange way. It's like you can almost feel your tissues moving or reacting.
I'd like to share some of the studies I've researched on this. The efficacy of extracorporeal shockwave therapy on calcified and non-calcified shoulder tendinosis. It said that extracorporeal shockwave therapy has been proved to be beneficial in calcific tendinosis. That's what we want. We want to break it up and allow that beautiful, it's almost like a violin bow, that beautiful tendon that just works and glides in that joint. Another one would be shockwave therapy induces neovascularization at the tendon-bone junction. This was in rabbits. Thank you, rabbits. Shockwave therapy induces the ingrowth of neovascularization. Neovascularization may play a role to improve blood supply and tissue regeneration in tendon-bone junctions. Tissue regeneration, I can look at you in the eyes and say, this helps regenerate tissue. This machine helps regenerate tissue. Going on, extracorporeal shockwave therapy in calcific tendinitis of the shoulder. Here they say ESWT in calcific tendinitis of the shoulder is, quote, very effective. We like effective treatments that have no side effects. That sounds like a good thing to me. Sign me up for that, please. I'll take pain-free to go. Here's another one. Shockwave therapy for calcific tendinitis of the shoulder, a prospective clinical study with a 2-year follow-up. 2-year follow-up. Are they still doing good? Is everybody okay? The control group didn't do so good. 83.3% were in poor condition, whereas the shockwave group, 90.9% of them were either excellent or good. That sounds like pretty good odds to me. I'll take it. Going on, shockwave therapy versus conventional surgery in the treatment of calcifying tendinitis of the shoulder. It was a head-to-head combat. Let's see who wins. Well, the authors conclude, and they prefer using ESWT as the first therapeutic option because it is a non-invasive method. And guess what? They did exactly the same. There was no difference. They did incredible, but even after 2 years, the shockwave therapy started to do a little bit better.
till finally within a month, I'm swimming the crawl, and I wasn't even able to move my arm 3 weeks ahead. It was wild. I had a great time, and I'm really passionate about this treatment.
Why go through an expensive surgery that causes scarring, risk of infection, and problems when you can get the Piezowave, right? Focused shockwaves, very little pain or discomfort when doing the machine, and we're gonna get you throwing touchdowns and cheering again. Let's do it.